I'm one of the founding directors and the clinical lead here at Kids Point, Mangara. We are a multidisciplinary practice consisting of a team of speech therapists, occupational therapists, and a dietitian. Therapy assistants, psychologists, a visiting audiologist, pediatricians, and some visiting specialists, including a cardiologist and a pediatric surgeon. We serve children and families in our immediate community and from all over the Central Coast.
We have been operating for 6 years now, and we're lucky enough to have a pretty amazing purpose-built space. Altogether, I think there's 38 different contractors, employees, and different services that we offer. It is quite a large multidisciplinary practice, and it's one thing that we do pride ourselves on. The key thing is everyone really respects each other. They all collaborate really well.
So working as part of a multidisciplinary team, I think first and foremost it's respecting and understanding each role each profession plays in improving patient outcomes. So understanding what we all can bring to the table allows us to then work together to improve that patient's outcomes.
Recognising that you're part of a team, and it's the team that's effective, it's not the individual, because we find ourselves pretty much, I'm treating the same children as many other of the clinicians in this building. We're all treating them and we all want the same outcome, which is effective treatment.
Everyone's kind of on the same level, like no one thinks there's a hierarchy because we have lots of different practitioners here, and it's just a really lovely environment to have and learn as well, like you're learning from different disciplines as well.
The benefits of an allied health professional working in a multidisciplinary team is that you can extend your skills. If you have a particular area of strength and you are working with a client, you can bring in one of your colleagues or team members to support you.
It's just expanded my knowledge and skill sets so much, working so closely with OTs and psychologists. A lot of the time, clients don't just fit the mould of a client that presents with a certain issue. There's obviously a lot of the time other complex things going on as well that we're not familiar with how to address. So I think it's super useful and beneficial to have access to other professionals.
From a professional perspective, it is very rewarding to be able to support a client far more holistically, because I know where my limit is in terms of what I can do. I can then make sure with the right input from an OT and a physio or a speech therapist, for example, we can then help improve the overall outcomes for that child.
I think there's lots of benefits for patients who come to Kids Point because usually they call it a one-stop shop. They've got everything they need under the one roof, which is really helpful. But something that we do a lot here at Kids Point is multidisciplinary case conferences and meetings where the different practitioners working with the child will all get together to review the therapy goals, to discuss what's working, what's not working, and how best to support not just the child but the family. So I think that's really beneficial because it really allows for a holistic approach to therapy rather than working in silo.
The experience for the parent, I think, is also far better. It's less frustrating. They feel heard. They feel like they've been listened to. And they also have not had to repeat themselves 100 times over.
My children use this service here. Oh, it's great because Rodney, for example, needs speech therapy and OT. Teresa, the youngest one, she needs speech therapy, started off needing OT. Having a multidisciplinary team means that they can look at them as a whole and then signpost them off into what's going to work best for them. And if you've got all the input you need in one place, so much easier for the parent because you've got one appointment at 10, one appointment at 11, you haven't got to dart around everywhere, and then they can talk amongst themselves as well, and that's great.
I love being a part of a multidisciplinary team. I don't think I could ever work in a clinic that was not. It's just so important to address all areas of a child's development.
If we were all isolated, we would never be able to have the same efficacy and the same good outcomes as what a multidisciplinary team can have.